The state health department says there's a confirmed case of clade 1 mpox in Connecticut. Fox 61's Kay Pattyfoot spoke to officials about whether people should be concerned.
People I spoke with say they aren't worried about the first case of clade 1 mpox being detected in Connecticut. Wednesday afternoon, DPH identified the first case of clade 1 mpox through testing performed at the state public health laboratory. The person with this case recently traveled to Western Europe where clade 1 mpox is currently spreading. Officials at DPH say this case doesn't pose a risk to the public. Doctors like Paul Anthony, who specializes in infectious diseases, explained how it spreads and says people shouldn't panic.
If people are going to be having, it's usually like repeated close contact or through soiled linens, like if people have contact with the lesion that the person has, it can be transmitted sexually. So those are the folks I would say right now might be a good time to talk to their provider about their personal risk. And then if they're at risk and they have not been vaccinated, this is the time.
People I spoke with in Hartford say they have mixed opinions when it comes to clade 1 mpox and the hantavirus.
I feel like it shouldn't be no threat, but a lot of people will be threatened because of it. And I feel like others shouldn't be threatened by it because we already got over the pandemic with COVID, so we could overcome this one. Just be smart, basically.
I want to catch it, and I hope it's not another, like, what's that word? Quarantine, yeah, like the coronavirus.
When it comes to clade 1 mpox, some symptoms include skin rash after flu-like symptoms, blisters, fever and chills, and headaches. DPH urges people who may be at risk to get fully vaccinated with the Jynneos vaccine. Dr. Anthony broke down who was at risk of getting this illness.
Men will have sex with men, whether they just have sex with men or they're bisexual. But there's also a risk of, like, within the household, if someone gets it and people are caring for them, like, there's also a risk there because they're going to have repeated contact with them as well.
If you do think you're at risk, you should contact your health provider and get vaccinated. In Hartford, Kay Pattyfoot, Fox 61.